Hello, my name is Joshua Hibbert, and I'm with New Brunswick Alumni Kappa League, and you're watching Kappa League TV.
Please introduce yourself for our viewers.
Good morning. My name is Dr. Larnie Booker. I'm a general pediatrician at Advocate Mid Jersey Pediatrics, and I'm an assistant clinical professor in the Department of Pediatrics at Robert Wood Johnson University Hospital.
What is the purpose for this event today?
Well, we're glad to be here today because we want to do a promotion about breastfeeding. 1 in 4 mothers breastfeeds until about 6 months of age for their newborn. The recommendation for the American Academy of Pediatrics is exactly 6 months. So only about a quarter of mothers who are breastfeeding are able to do it for that period of time. So we want to provide information for parents, we want to encourage them, and we want to help close some of the gaps that we see in the disparities in women of color with breastfeeding versus the national average.
Why is breastfeeding important?
So breastfeeding is very important in that it's the primary source of nutrition. All formulas are made to imitate breast milk, not the opposite way around. Breastfeeding is also important because it improves the health of the infant. It also improves the health of the mother overall. And so we want to continue to have women be in their best space, be in their best mental health, physical health, and also have their children be in their best health as well.
Why are the numbers as low as they are?
Well, overall, breastfeeding is a little bit of a challenge for some moms. Some kids are born right away and they are able to latch very easily. Some kids are born premature and they don't have the ability to breastfeed initially. And so there's a lot of different factors that go into it. Some people are just not comfortable nursing. Like I said, it's not easy for every mother. So the more information we can provide, the more support we can provide, the better the options will be for mothers who want to breastfeed.
What benefits does breastfeeding have over formula feeding?
Well, you decrease the number of ear infections and lower respiratory tract infections in infants. You decrease milk protein allergies or food allergies in infants. But for mothers, you decrease their blood pressure, you add to their mental health, you decrease obesity. And while some mothers think that breastfeeding is the best way to avoid pregnancy, it's not a full-fledged measure. So I would advise mothers who are trying not to have kids not to use breastfeeding as their primary source of birth control.
What would you say to a mother who is having trouble breastfeeding?
So really important. It's important that they have the resources that they need. There are lactation consultants available at your local hospitals and within the community. The doulas at a lot of the OBGYN offices also provide breastfeeding support. And then there's groups like La Leche League that provide resources. So it's really important to discuss your breastfeeding desires with your OBGYN as well as with your pediatrician, and that way any issues that develop can be managed. One of the more common things we see is babies who have oral tethers, so whether it's a lip tie or a tongue tie, and those affect the way the baby latches onto the mother's breast. So we want to be sure to address those issues so that breastfeeding can be successful.
Dr. Booker, thank you for your valuable information.
Oh, you're welcome. I'm glad we could be here today. Thank you.